Hi, my name is Jacob Perez, and so I'll be talking about my research project with the athletic training program. My research project was done at Northwestern University with the football team. That's where I'm having my capstone internship placement at. I'm talking about the comparison of Fusionetics movement efficiency scores among wide receivers and offensive lineman athletes. Basically, Fusionetics is an evidence-based clinician rated outcome, and we can use that to identify risk factors for injury. It also just helps us understand how our athletes are moving more efficiently. It has an app, so that makes it kind of different than some other clinician rated outcomes. It also removes some subjectivity from it as well. Just saying that if I score it and another clinician scores an athlete, hopefully our scores are very similar. Whereas in the past, other clinician rated outcomes will have more subjectivity and therefore have different scores, and then the treatments are planned differently. So I'll get into that a little bit later, but basically Fusion X can help to identify asymmetries in the body, compensatory movements. So somebody's not moving correctly, but it appears that they're moving correctly because they're compensating in a way. So we can identify these compensatory movements and try and catch them on the front end, so that way they don't cause issues for the athlete on the back end. It also helps us determine movement efficiency overall globally with the body and kinetic chain, which is very helpful. It doesn't kind of isolate things to one body part. It kind of looks at everything as a whole, but also breaks it down as well, so you can kind of see your score. So the patients were Northwestern football athletes. We took data from two wide receivers and four offensive linemen. The average height and weight of the offensive lineman is 6'5", 285 pounds. The average height and weight for the wide receiver is 6'3", 198 pounds. Um, Something important, this is kind of what it'll look like in the app. So this is how it determines your movement efficiency score. Scoring a 0 will show hypomobility and 100 will be hypermobile. 100 doesn't mean you have a perfect score. 0 doesn't mean you have a terrible score. It just needs to be interpreted by the clinician to guide treatment. So having 100 could be a bad thing or a good thing, and having a 0 could be a good thing or a bad thing. It's important to recognize that there's no better score than the next athlete. It's just everybody's individualized and has different scores. The movement efficiency helps capture upper and lower extremities, so that's very helpful. Some only do one in the past, so basically you'll go through these movements, squats and push-ups, and also things for shoulder movement. And us as clinicians, we will look for these errors. We will choose these errors on the app, and then it will determine this movement efficiency score at the end. The bottom line for this is that this data can help athletic trainers understand movement patterns better by position group and specifically for sports. This can help to decrease injury and increase performance in general. It's important to realize that this is just a tool, and us as clinicians, we need to look at it and interpret this data to help guide our rehab better. The conclusion is that wide receivers had a score of 77.2. Offensive linemen had a score of 61.9. And this shows that the wide receivers are more mobile than the offensive linemen. Again, this is not a good or a bad thing. It just, they have different scores, and we're going to guide our treatment accordingly. Thank you for your time.